Alright, so before before entering my patient's room, I'm going to make sure I go ahead and check the MAR to make sure that this IV insertion is supposed to be done at this time. And then I would also go ahead and check the medications that are going to be going into the IV and make sure they are not expired or anything. Right, then I would enter my patient's room. I would knock on the door, close the curtain, perform hand hygiene, and then I would introduce myself. And then I would ask the patient to verify their name and date of birth. And then I would also ask the patient if they have any allergies, and this patient is allergic to penicillin. And then I would also assess for any pain they might be having, and then administer some medications if needed before we start. So to go ahead and start, I'm going to go ahead and apply the tourniquet just to her arm. This is just for the purpose of the video, but normally it would be above and it would be a lot tighter. Okay, and then I'm just gonna pop it for now so that I can go ahead and use it for the video. I'm gonna put my gloves on. I'm gonna go ahead and swab this port so that it's all sterile and clean. Okay, and then I'm gonna go ahead and attach my flush. I'm just gonna go ahead and prime it so that I know it's patent. Alright, and then I'm just gonna set it to the side for now. And then now I'm gonna go ahead and swab, or I'm gonna palpate the vein so that I know where I'm headed at. And then I'm gonna go ahead and swab vigorously so that the areas of the skin's all clean. I'll just do this for a really long time, and then I would wait 30 seconds or so for it to dry. Once it's done, and then I'm gonna go ahead and take my needle. I'm gonna go ahead and hold the skin taut so that I can get the best angle for my insertion. I'm going at an angle. Go ahead and get this catheter off.
Yeah, it's not my fault.
Alright, and then I'm going to go ahead and attach this port now. And then before doing anything, I'm going to make sure to pop the tourniquet. I'm just going to go ahead and flush it. And then I'm going to go ahead and pull back for some venous return. And just flush one more time. And then I'm going to go ahead and take the flush off of here. Just prop this up here, and I'm going to go ahead and tape it down so that it's secure. And then normally would stick a lot better. Get one up here too. Okay, and then I'm going to go ahead and take this dressing to go over it.
It's like doing like the snap and clap and all that.
And then on this, I would make sure to write down my initials, the date, the time, the gauge to help out the next person or the next nurse that comes in here. And then normally that would also stick better. And then I would make sure before leaving my patient's room that the bed is in a low and locked position, side rails are up, the call light's within reach,